they'll be calling for your attention. So it's an abridged version. You understand? So we just selected a few things that we can handle now. But good enough, this is a virtual research. It means that by the time we are done introducing you to by the time we are done introducing you to the virtual space today for research, it means you can actually go on accessing the research clinic resources through our website and get additional material. You can send in your query, some of the issues that you have in your mind concerning your work and even those around you. That's the purpose. So it's mainly like an introductory course. So we are looking at the considerations that you might need to look at when you are designing a clinical research. I also understand that some of you are almost done with your part 2 project. Some might be just conceptualizing, still trying to go back and forth. But at whatever stage you are, it doesn't matter. If what you have learned today is something that you think, I wish I had known this 6 months ago, it doesn't matter. Like Prof mentioned, when you are done with your part 2, it's not the end of research. In fact, part 2 was meant to forcefully introduce you to research, so that whether you like it or not, it's part of the exam. Because of exam, you will do it. But then beyond that, we should engage in research as clinicians. Alright. Number 1, research is systematic. So if you look at this diagram, just illustrating, it's like a system of levers, I mean, what they call it. Like you have in engine, those complex engines and co. But that's actually how it is. Now, at different time, you may just be in one of these circles there. But whatever you are doing in your research is connected to what other people are doing, what others have done, and what others will do. And eventually, it's all of it that is put together to lead to development. There is a formula in sampling size calculation. That common formula, what is it called? That simple formula for calculating sample size. Cochrane, there's another name for it. Leslie and Kish. If you check the reference, discover that Cochrane first formulated that formula in 1963. And then if you see other literature, you see that the same formula was ascribed to Leslie and Kish, I think 1965 or thereabouts. There are some years apart. And I used to ask myself, how come the same formula, 2 people lay claim to it? Okay? And then I got to find out that what probably may have happened was that at that time, there was no internet, okay? So you could have a Cochrane somewhere in Paris, or somewhere in France, or somewhere in Germany, looking for a solution on how to calculate sample size. I've been working on it and struggling, and then finally one day he found it. And then he goes to a conference in his country and presents it, publish it in their local, I've seen old journals or something, very local, and publish it and they will put it to his name. Whereas at the same time, somebody else, Mr. Kish and Leslie, they are working on that part of maybe Switzerland, trying to solve it. And then they also found, you know, principles of science are the same. They also found the same formula. And then they also publish it in their own local journal in their country. Not knowing that Cochrane and colleagues have also found the same formula elsewhere. So eventually, when internet or international travel became popular, you go to a conference and discover that, I don't know about it. It's Oshuna, I think Oshuna. She's working on something, I think povidone, iodine, and chlorhexidine, cleaning, what do you call it now, before surgery. Yeah. So she's trying to look at, which is better. Are you going to have better outcome, or will the outcome be the same? So usually clinicians are concerned about care. You want to consider, we are going to have better treatment at lower cost, with lesser complication, better outcomes, and then could it even be that we could have an approach to care that doesn't require all the expertise? Meaning that what you are practicing here in ISP, a very big institution, could you modify it and make it feasible to practice in the where now? Where are you from? Where is the of your village, not your city? Where are you from? Where is this village? Okay, I'm from the city. Now, what's from the village here? Promise. So, promise you want to ask. The thing you are doing here, that you have to gather all the arrays of consultants. You will need to call radiologists. You need to call who do you want to call? Anesthetists, to be able to set. Is there any way to modify it so that an MO and a nurse can do the same procedure in infant, and you have the same outcome. Do you understand? So we want to improve care, also improve the efficiency of care, using less to achieve more. So what are the types of clinical research? Prevention research, as the name implies. We want to look for better ways to prevent disorders with screening. How do you, we talk about predictor. How can you predict outcome of pregnancy with respect to a fertility disorder, for instance? How do you predict outcome, maybe for elective surgery or emergency CS and all of that? So screening research. Then of course diagnostic research. We want to look at what can we do better to identify particular disorder or condition with lesser resources. What about treatment research? Things like new medication. We talk about chlorhexidine, just now. What about better therapy, new devices? I remember then we were doing our post in O&G as a medical student. They talked about one new device they had just found. I forgot what it was called, I can't remember. But it was something that was a product of a research. New approaches to surgery, new approaches to research. What about quality of life? People in family medicine, they are very good at this. Quality of life studies. I have reviewed and supervised somebody's work that had to do with quality of life for, I think, chronic osteoarthritis. So the study was about with respect to adherence and the ability to cope and all of that. So you can also do studies along this line with respect to your patients, maybe quality of sexual life after a certain kind of study that may affect the reproductive system, for instance. Post-menopausal life. Well, those are your areas. So you can, what are people experiencing to improve life? What about genetic studies? This one are almost like far-fetched. You're looking far-fetched for us, but in the local country, this is where they are. This is what they are after. They are looking for which gene can you alter that will make it almost impossible for an elderly person to develop osteoarthritis. What gene can we are battling with eclampsia now. What gene, what manipulation can we do to reduce the risk factor and people being susceptible to eclamptic disorders? So these are some of the areas of clinical research. So we can choose to do any of them. And we are looking at the design. So we are going to have another lecture on this, and he may talk a little more about design. But my focus here is how these designs affect your consideration. What do you consider when you are choosing to do research? What comes to your mind? That's what you are looking at. So study types can be divided based on intervention, based on the design, and then based on time. Based on intervention, two categories. We say observational studies and then experimental study or interventional studies. What is the intervention? That you are introducing an exposure. Observational study means that you are not doing anything to the study population. You are only going to study them the way they are. You make them, you want to just check, okay, what is the booking age of women, average booking age of women in rural, booking GA of women in rural versus urban area, and what are the implications of outcome of pregnancy. You are not doing anything today, you are just studying them. But for interventional study, please, you are introducing a factor into the, maybe you are going to compare placebo versus a particular medication, or a regular medication you are using for maybe hypertension. You want to introduce something else to see how does this new medication compare with what I'm using before. Those are what we call interventional or experimental studies. We also have studies that are classified based on the approach of the design. So here we have things like qualitative study. Here you talk about things like focus group discussion, where you gather people together and ask for their opinion. They give you feedback, you do audio recording, and then go back and interpret and summarize what they are saying. You don't use them for things like that require opinion, perspectives, how people perceive things. They also have the regular one which you are used to, quantitative study, in which you do survey. You are using things like checklists. You are using your regular questionnaires, okay? You are going to calculate proportion, how many percentage, what is the prevalence of anemia in pregnancy, what is the prevalence of adverse outcome following a certain procedure. Then we have what we call mixed method, as the name implies, the kind of study where you are combining both qualitative and quantitative approaches to them. So these are becoming popular now because virtually for every condition you want to study, there is always that social aspect of it, opinion information from both approaches. We also have studies that are classified based on the time. So you have things like retrospective study. You are looking at the situation
way back. You are going back to look at the data that already gathered. You also have perspective, as the name implies. You are all right. Now, what are the considerations when you have to do the quality of research outputs? So, research output refers to textual outputs where research is understood as an original, systematic investigation undertaken to gain knowledge and understanding. So, the words there underline are original. Your research should be original, not copy and paste. Even if it's the same topic you are working on, talk about it in your own perspective. Introduce new objectives. They may have done an objective that look for prevalence in one population. You can introduce the other. You want to compare the prevalence in one population versus the other one. You get it now. So be original in your data collection. Be original in your discussion. That's what your voice is. Then be systematic. Research is not as you feel like, do as I feel like. You know why? People are going to look at your work. They will compare your work with other work that has been done. And then if your own doesn't follow the known pattern, your work will be discarded. And at the end of the day, ask yourself, this my research I'm doing, is it contributing to knowledge? Is it improving understanding? So, this statement, I should have put it in red. Look at it there. Let's read together. Second bullet point, they can read together. 1 to go. Research and no respect of poor research. No respect. If you do shabby work, they will just push it aside. When you stand somewhere saying, he has not said anything. All those men that they are hailing, all the Professor, you know Professor Kolofa is one of your very simple people. I met him. I met him at Rome earlier this year. When I was ready for that conference, World Congress on Public Health, Kolofa is an O&G person. I was ready for the conference. After they sent me the brochure, I was looking through to see how many of us are coming from Nigeria for the conference. And then I found one person and then one person in Ghana, very few blacks. And then I saw his name. But you know where I saw his name? I didn't see his name as a presenter. I saw his name as one of the person chairing one of the what's it called? One of the sessions. He was chairing one of the sessions. I later got to know that he's a member of the board of that World Congress on Public Health. Now, what took him there? It's not because he's from Beirut. People know he's from Beirut. Nobody cares about that. Okay, he's a UBTH in one place in those states where Governor Bekele to sink in more. Sure, Governor Bekele to sink in there. Not record that one. Nobody cares about that. But if you go online and browse his name, you will see the kind of research he's involved in. It's not this one that was named myself. Grant-funded research. Organization-funded research. Not individual, I have gone beyond that one. What gave him that respect? In Rome, the official language for that conference in Rome was mainly Italian. But because people that came at home, people that came from Africa, they had to provide the English version. So you have Italian version. As I can imagine that day, when I didn't go to a session because I had a presentation on that session. Can you imagine he was talking and they will be interpreting for Italians to hear because it's respected in the world of research. If you have poor research, nobody will respect you. Quality research is the hallmark of professional, whether within ISTH or outside ISTH. Now look at these are the type of output I'm referring to. How we can see this? For time's sake, I'll just go through only the one on the left column. Contribution to journal, that's an output of research. Chapter in a book, you can contribute to a chapter in a book. Report, conference proceeding, you can write a book. All right, you can write even a simple activity that you do. For example, I am aware that every department organizes one word day or the other, one program or the other. Just merely writing that report, adding a reference, you can send it online. It becomes credited to you. Do you understand that? So it can be a report. What about working paper? Conferences where you have paper, poster presentation, abstract presentation, keynote speeches, all right, strategic sessions, and then of course, non-textual forms such as software. Somebody designed SPSS. That was somebody's contribution to research. Digital and visual products. For example, here in the clinic, somebody designed virtual clock that uses the clock as a means to explain the virtues that promote research integrity. These are contributions to science. And of course, your thesis, your part 2 work, they are contributions to research. But if you do your part 2 work and you keep it in the shelf after finishing your exam, you are not contributing anything. Maybe it's only the chicken and fried rice and the wine department drunk is it presented. So maybe have it a point of mind that when I finish, I'm going to publish this work. It will guide you. You'll be conscious of what data you are collecting and how you are collecting it. Remember that in the world of research, nobody respects poor research. So what are the considerations? Simple things we are used to. In clinical research, the population, don't choose a population that you don't have access to, or that will be difficult for you to access. Okay? Or that your work schedule will not permit you to go and carry out the. So choose study population that you have access to, that are relevant to your research questions. I've seen a few persons in the hospital here who chose the research topic, but they don't realize afterwards that they don't have enough patients in ISTH to meet the sample size. So they are not thinking, should I go and include general hospital, general hospital, wherever? Follow the control. Number 2, consideration, the research question. Ask yourself, what question does my research seek to answer? What is the question? In fact, after you have chosen your topic, try and turn your topic into a question and see whether the question makes sense. And then ask yourself, within this environment, within the time I have, within the resources I have, and within the kind of expertise I have around here, can I effectively answer this question? If people cross-sectional study is enough for me to get the data, if it's going to be a prospective study, how many months will I run it for? If I'm to exit the program, for example, in 6 months' time, I will not have those 6 months to collect my data, right? If the data collection requires 2-year period, will the department allow me to try for 2 years? Because the question you ask yourself, it will affect your design and then affect many choices along the way. Then, number 4 consideration, the research team. This is beyond the part 2. Now, usually part 2, I know it's you and you alone that will do it. But beyond part 2, when you want to carry it, ask yourself, can I improve on the quality of this research if I taking a colleague from pediatrics, colleague from community medicine? Does the study have to do with mental behavior? What if I call my friend in psychiatric department? You understand? Multidisciplinary, interdisciplinary, where you bring ideas together to improve the research. But now the world is gone beyond these first 2. We are now moving to the realm of cross-cutting research. What does that mean? It means research that bridge disciplinary core boundaries, okay? And then having value that we cut across much of science and health. So we are doing the study, it's not just because it's O&G related, but the outcome of the study will benefit O&G in addition to other areas of medicine. Even in addition to social behavior, in addition to religious behavior, in addition to science. For example, we don't have time, I wanted to ask us an example. Studies in social sciences, they have clinical version. Studies in clinical medicine, they have partial social sciences. Okay, you are looking at antenatal care. You want to know how early the women book have been, and if they book early or late, how does it affect their care, affect their progress, and affect their outcome? What about if you want to take it down home to the family? What are the issues in the family level that affect how early the woman will book? Or after booking, why should it disappear? They won't book and that, you won't see them again. They won't come again. The next time they will come is on the night of delivery. And I understand those kind of things now. They will come down and say, matter how you book, you say, I book. Bring out a yellow folder, you check. Since that day of booking, no other documentation whatsoever. And then the next day, your matter, you don't try, you don't come out and worry of this night. But if you find that, there are reasons why that woman booked and disappeared. There may be social issues, family challenges. Maybe after her booking, the husband left her. They got married, after booking, while I enter the family, the man just walk out for months. So it's not good the pregnancy matter, the woman is confused and all. So there are usually issues. These are cross-cutting research issues. So a long list here, we do not have time to go through, but a few of them, adolescents and child and young adulthood. It concerns you, determinants and promotion of well-being, okay? That can involve O&G, community health, and family medicine. What about look at the other side, social, cultural, and economic diversity? How it affects care, how it affects compliance and adherence to clinical care, substance abuse, things like this. It requires more than one specialty to adequately carry out research in this area. Then finally, before contribution, the analysis. You have to consider this. Ask yourself, how can I analyze this work? Do I have the resources to analyze it? What kind of software will be used? How will data be entered? At this point, you ask yourself, should I use questionnaire to collect the data, or should I use Google form? We're following a Google form like fairly popular now. What about ODK? What's my plan for analysis? What kind of variable am I going to be dealing with? And how do I measure the variables in such a way that they can answer my research question? One of the students that I'm supervising right now sent me their group of 4, sent me their work some days ago. When I was reviewing it yesterday, there was one question they asked, and I simply wrote there, your research work cannot answer this question. You know, they just wrote. So that's what we're there to guide them. So you watch out. Don't ask questions that your design and what you have cannot handle. What about the technique for analysis, statistical techniques? We'll talk about that later in the next lecture. But you have to consider this when you are doing your work. Finally, research is systematic inquiry. That was thematic is the center of research. It means that everything you do follows certain pattern. You don't just choose to do whatever you like. It won't be systematic. And the output of a good research will outlive the researcher. If you publish well today, even after you are long gone, keep making reference to it. Maybe be that your work that you're looking at small may be what gave somebody an idea that made it to have a breakthrough research and won one prize somewhere. But it will reference you that it was what you saw here. Simple small work from Iran that stimulated the idea that led to this other bigger research. Thank you for your attention. Thank you. So we will take questions at the end of